it's not very well known that articular cartilage, which is the cartilage that is over the surface of the bone, can actually grow back in one particular patient population. That's the under 20-year-old. So to give you a little bit of background, this is a knee joint. That's the meniscus. The ends of the bone have articular cartilage, and then the surface of the bone has articular cartilage. The articular cartilage is a bit like the Teflon coating on a fry pan. And then the meniscus, obviously, is the rubber, thicker substance. Articular cartilage in under 20-year-olds has a good blood supply. Because it has a good blood supply, if part of this, I put a little dot on the end of this bone, if you were to have an osteochondral defect and part of the cartilage fell off in your daughter or son who was 12 years of age, the best treatment for that would be to take that out. They'll put in a microfracture where they'll puncture some holes, cause some bleeding. When that grows back, because it's got a great blood supply around the area, the articular cartilage actually grows back perfectly. We know this is the case because we've had patients who have had an arthroscope to take that osteochondral defect out. They've then gone back, done the rehab. 10, 15, 20 years down the track, they've gone back in and had another surgery. Perhaps they've torn their cruciate. Lo and behold, the cartilage here at arthroscope is exactly the same as at birth. It's normal. It's completely grown back. And in fact, I had a patient the other day who had an osteochondral defect here at 15 years of age, had that taken out. And then he had surgeries, had subsequent surgery down the track, 20 years down the track. And the surgeon was absolutely surprised that it had completely grown back, not as fibrocartilage, but as articular cartilage. You couldn't tell the difference. So this is a fact-breaking little YouTube video again. If you're under the age of 20 and you hurt the articular cartilage, the best thing to do, by the way, you don't try and stick it back down at that age. You just take it out. It doesn't work in sticking down. It just comes back off. And down the track, that cartilage will grow back well. There's probably one take-home message for me is that once they've had the surgery, the microfracture and so forth for that, over the next few years until they hit their late teens, early 20s, you'd probably well advise not to go back to level 1 sports, long distance running, just to allow that cartilage to fully recover. And then we can pretty much guarantee down the track in their 20s, 30s, 40s, 50s, the cartilage will grow back. Something I was unaware of. There's not a lot of literature and data on this. We get this information from experienced orthopedic surgeons. I talk regularly with a Professor Pinczewski in Sydney, who's very well known, and his group of researchers after their 20,000 or 25,000 knee operations in a whole vast range of operation age groups. They recall this sort of information. It's not published. However, fascinating stuff, and hopefully that's useful for, especially for parents whose kids have articular cartilage damage at a younger age.